to clarify several points on what exactly is the policy and the plan on travel requirements. We have with us on the line Health Undersecretary Leopoldo Vega. Usec Vega, good evening and welcome to The Big Story.
Good evening, Avi, and good evening to all. It's a pleasure to be with you all.
Yes, Usec, I mean, obviously the main concern right now are, travel documents, vaccination cards. We saw initiatives on the LGU level, different LGUs having different systems to ensure na hindi mapepeke at hindi magkakaroon ng counterfeit cards. But how do we ensure that on a national level when it seems like there is no database sharing, there is no, in the words of Secretary Duque, interoperability on the data being generated by the LGUs?
Okay, you should understand that when the vaccination started way back in February, March, and April, most of the LGUs started to use their own QR codes and the vaccination cards. Even the vacuna centers of the hospitals were making use of IDs and even vaccination cards, which they would give to all of the vaccinees. However, there has to be a standardized form to this, and there has to be a main repository. And that's where DICT came in sometime in April, wherein they need to come up with a listing and a database for all the vaccinees in the vacuna center and the hospital. And this is one way of really making sure that the vacuna card will be digitalized. So we will have a digital certification. But the problem is right now, there seems to be a long backlog in terms of encoding the number of vaccinees in the LGU and in the vacuna center towards the DICT Vaccination Information Management System, or the VIM. Because the VIMs actually will give you the digital certificate that you were actually vaccinated on a certain date and at a certain time. So this eventually, when I think by the end of July and August, when most of the LGUs will be able, and even the vacuna centers, the hospitals and the different vaccine centers would be able to encode and make sure that they are able to put in the necessary data in the VIMs of the DICT, then it would be easier for us or for the DICT to issue vaccine certificates or digital certificates so that a person traveling towards another country or intrazonal won't have any problem. So this will take time. Probably by August, I think, they will have a better repository of all vaccination cards in one storage area. That's the DICT.
That's fair enough, Usec. But where are we now in having that interoperable database, especially given that, as you said, we started talking about this with DICT in March or April, and at the same time, in fairness, even before actual vaccination, we were talking about databases. We were talking about interoperability between LGUs. Even before that, we were talking about it in the context of contact tracing. We were talking about it in the context of testing. That seemed to have been a common theme at every stage of our interventions. Now, I mean, pardon me, but it sounds like still an afterthought in creating a database when a lot of people would have thought that by the time we started to vaccinate, this should have been one of the early factors in rolling out.
Right. Robbie, I think it would be different to compare the contact tracing with this vaccination information system that we have right now. The contact tracing, we did have problems in terms of the donation and in terms of the capacity of the Stay Safe program to make sure that it is going to be integrated and operable in all the LGUs, because most of the LGUs were starting off with their own kind of monitoring devices, especially for contact tracing. But in this vaccination, I think we're starting off. We're kind of late in terms of the repository of all of the vaccination cards into one system. But I think the DICC is right now on the upper hand, and it's the lead agency to do this. And he is able, I think the DICC will be able to compel the local government units and all of the vacuna centers to at least enter and encode. Because if once this enters into the one system, into the DICT storage data or the VIM, then it's easier for us to get a notice whether you have been vaccinated through a digital certificate.
Okay, maraming salamat po. DOH Undersecretary Leopoldo Vega.